Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Patient engagement in discourse analysis. Interactive assistant patient engagement refers to the active involvement of patients in their healthcare decisions, interactions with providers, and management of their health conditions. In discourse analysis, patient engagement is examined by analyzing the language used during healthcare interactions, such as conversations between patients and healthcare providers, written materials like treatment plans, and digital communication like patient portals. Discourse analysis focuses on how language shapes the degree of patient involvement, the sharing of information, and the negotiation of roles between patients and healthcare professionals. Through discourse analysis, researchers can identify patterns in communication that either foster or hinder patient engagement. This includes examining power dynamics, the use of medical jargon, the framing of health information, and the way empathy and support are communicated. By understanding how language influences patient engagement, healthcare providers can improve their communication strategies, fostering a more collaborative and patient-centered approach to care. Key features of patient engagement in discourse analysis. 1. Shared decision-making. Shared decision-making is a central aspect of patient engagement, where healthcare providers involve patients in discussions about their treatment options, allowing them to make informed choices. Discourse analysis examines how language either facilitates or limits this process, focusing on how information is presented and how patients' preferences are considered. Example: a doctor might say, "There are several treatment options available. What's most important to you when making this decision?" Discourse analysis would explore how the doctor's language opens up space for the patient's input, encouraging active participation in the decision-making process. Alternatively, a more directive approach like, "You should take this medication," might reduce patient agency and limit engagement. 2. Use of medical jargon in plain language. The use of medical jargon can create barriers to patient engagement, especially when patients struggle to understand complex terms. Discourse analysis investigates how healthcare providers balance technical language with plain language explanations to ensure that patients comprehend their conditions and treatment options. Example: a doctor might explain a diagnosis using jargon like, "You have atrial fibrillation, which is causing an irregular heartbeat," but then clarify, "That means your heart is beating unevenly, which can cause fatigue or shortness of breath." Discourse analysis would explore how the use of both technical terms and simpler explanations impacts patient understanding and engagement in managing their condition. 3. Questioning and information exchange. Healthcare providers use questions to gather information from patients, but the types of questions they ask, open-ended versus closed-ended, and how they follow up on patient responses significantly impact patient engagement. Discourse analysis focuses on how these questioning techniques either encourage patients to share more information or restrict the conversation to brief, surface-level exchanges. Example: a provider might ask, "How are you feeling today?" open-ended, allowing the patient to express a range of concerns, versus, "Are you experiencing any pain?" closed-ended, which limits the response to yes or no. Discourse analysis would examine how the former fosters more in-depth engagement, while the latter might limit the patient's input. 4. Empathy and emotional support. Empathy and emotional support play a critical role in patient engagement by helping patients feel understood, valued, and supported in their healthcare journey. Discourse analysis examines how healthcare providers use language to convey empathy, and how this affects patient trust and willingness to participate in their care. Example: a nurse might say, "I know this must be difficult for you, but we're here to support you every step of the way." Discourse analysis would explore how this empathetic language builds rapport and enhances the patient's emotional engagement with the healthcare team. In contrast, a more detached or clinical tone might reduce the patient's sense of being cared for, affecting their overall engagement. 5. Patient narratives and personal experience. Patients often share narratives about their symptoms, experiences, and health concerns during medical encounters. Discourse analysis looks at how these narratives are constructed and how healthcare providers respond, focusing on whether patient stories are acknowledged and incorporated into the care plan. Example: a patient might describe a recurring symptom in detail. "I've been feeling really tired every afternoon, and it's been getting worse for the past few weeks." Discourse analysis would investigate how the healthcare provider acknowledges and integrates this narrative into their diagnosis and treatment plan. A response like, "Let's look into what might be causing your fatigue," shows that the provider values the patient's experience, fostering greater engagement. 6. Power dynamics in healthcare interactions. Healthcare interactions often involve power dynamics, with providers typically holding more authority due to their medical expertise. Discourse analysis explores how these dynamics are negotiated through language, focusing on whether communication is collaborative or hierarchical, and how this impacts patient engagement. Example: in a hierarchical interaction, a doctor might use authoritative language such as, "This is the treatment you need," leaving little room for patient input. In contrast, a collaborative approach might involve the doctor saying, "We have a few options to consider. I'd like to hear your thoughts on which one feels right for you." Discourse analysis would examine how these different approaches influence the patient's sense of autonomy and engagement. 7. Nonverbal communication and engagement. While verbal language is central to patient engagement, nonverbal communication such as gestures, facial expressions, and body language also play a key role in shaping interactions. Discourse analysis can extend to these nonverbal cues, examining how they complement or contradict verbal messages and influence the level of patient engagement. Example: a provider might maintain eye contact, nod, and lean forward while listening to a patient, signaling attentiveness and encouraging the patient to continue sharing. Discourse analysis would focus on how these nonverbal cues support verbal communication, reinforcing the patient's sense of being heard and engaged. Methods for analyzing patient engagement in discourse. 1. Conversation analysis. Conversation analysis is a method used to study the structure of interactions between patients and healthcare providers, focusing on turn-taking, interruptions, and how questions and answers are sequenced. This method helps reveal how engagement is managed in real-time conversations. Example: conversation analysis of a medical consultation might reveal that patients who are frequently interrupted by their providers have less opportunity to express their concerns. The analysis would explore how these interruptions affect patient engagement and the quality of care. 2. Critical discourse analysis, CDA. Critical discourse analysis, CDA, examines how language in healthcare interactions reflects broader societal power structures, such as the hierarchical relationship between doctors and patients. CDA helps uncover how these power dynamics influence patient engagement, particularly in terms of whose voice is prioritized in decision-making. Example: a CDA of doctor-patient interactions might reveal that certain groups of patients, e.g., women, elderly, or marginalized individuals, are given less opportunity to participate in decision-making, with their concerns often being downplayed or dismissed. The analysis would explore how language contributes to these power imbalances and affects patient engagement. 3. Ethnographic discourse analysis. Ethnographic discourse analysis combines discourse analysis with ethnographic observation, studying how patient engagement is shaped by the broader cultural, social, and institutional contexts in which healthcare interactions occur. Example: an ethnographic discourse analysis of a multicultural clinic might examine how language barriers or cultural differences impact patient engagement, focusing on how healthcare providers adapt their communication to meet the needs of diverse patients. 4. Narrative analysis. Narrative analysis focuses on how patients construct and share their personal health stories during medical encounters. This method examines how these narratives are received by healthcare providers and how they influence patient engagement. Example: narrative analysis might explore how patients with chronic illnesses use stories to explain how their condition affects their daily life, and how healthcare providers respond to these stories. The analysis would focus on whether the provider's language supports or dismisses the patient's narrative, impacting their engagement in managing their illness. Examples of patient engagement in discourse analysis. Example 1. Shared decision-making in treatment choices. In a shared decision-making scenario, a doctor might present various treatment options to a patient with diabetes, We can adjust your medication, explore lifestyle changes, or try a new therapy. What do you think would work best for you? Discourse analysis would examine how the doctor's language encourages patient input, supporting engagement by making the patient an active participant in their healthcare decisions. Example 2. Use of plain language in explaining medical conditions. During a diagnosis explanation, a healthcare provider might simplify complex medical terms, saying, "You have hypertension, which means your blood pressure is too high." This can put extra strain on your heart. Discourse analysis would focus on how this plain language fosters understanding and engagement, making the patient more likely to adhere to treatment recommendations. Example 3. Empathy in mental health consultations. In a mental health consultation, a therapist might say, "It sounds like you've been going through a lot. I'm here to help you work through it." Discourse analysis would examine how the empathetic language used by the therapist enhances emotional engagement, encouraging the patient to open up and actively participate in therapy. Example 4. Power dynamics in surgical consultations. During a surgical consultation, a surgeon might take a more authoritative tone. "This is the procedure we need to do, and it's the best option." Discourse analysis would investigate how this authoritative language might limit the patient's ability to ask questions or explore alternative options, potentially reducing their engagement in the decision-making process. Example 5. Nonverbal communication in palliative care. In a palliative care setting, a nurse might sit close to the patient, hold their hand, and make frequent eye contact while discussing care options. Discourse analysis would examine how these nonverbal cues of empathy and attentiveness complement verbal communication, enhancing patient engagement by making the patient feel supported and understood. Challenges in analyzing patient engagement through discourse. 1. Complexity of medical language. The use of medical jargon can make it difficult for patients to fully engage in healthcare conversations. Discourse analysts must carefully examine how technical language is balanced with explanations that are accessible to patients with varying levels of health literacy. 2. Power imbalances. Healthcare interactions often involve inherent power imbalances, with providers holding more authority. Discourse analysts must be sensitive to how these dynamics shape patient engagement and how language either reinforces or mitigates these imbalances. 3. Cultural and linguistic differences. Patients from diverse cultural and linguistic backgrounds may face additional barriers to engagement. Discourse analysis must account for how language use in healthcare settings either accommodates or excludes these patients, impacting their level of engagement. Conclusion. Patient engagement is a crucial aspect of effective healthcare, and discourse analysis provides valuable insights into how language shapes this engagement. By examining shared decision-making, the use of plain language, empathy, power dynamics, and nonverbal communication, discourse analysis helps healthcare providers understand how to foster more meaningful patient involvement. Whether analyzing medical consultations, treatment explanations, or patient narratives, discourse analysis highlights the importance of language in building trust, enhancing understanding, and supporting patients in taking an active role in their health. Through this lens, healthcare professionals can refine their communication practices to promote more collaborative, patient-centered care. Frequently asked questions. What is patient engagement, and how is it examined in discourse analysis? Patient engagement is the level of involvement and active participation a patient has in their healthcare journey. In discourse analysis, it is studied by analyzing conversations between patients and providers, focusing on language that supports or limits patient participation in healthcare decisions. How does discourse analysis assess shared decision-making in healthcare? Discourse analysis looks at whether language in healthcare interactions encourages patients to contribute to treatment decisions. For example, language that invites patient input. "What do you think of these options?" supports engagement, while directive language, "You should do this," may restrict it. Why is the use of plain language important for patient engagement? Plain language helps patients understand their health conditions and treatment options. Discourse analysis explores how healthcare providers balance medical jargon with simpler explanations, making information accessible and fostering patient involvement in their care. How do questioning techniques impact patient engagement? Open-ended questions, e.g., "How have you been feeling?" invite detailed patient responses, while closed-ended questions, e.g., "Are you in pain?" limit responses to yes or no. Discourse analysis examines how these techniques either deepen engagement or restrict the flow of information. What role does empathy play in patient engagement? Empathy helps patients feel supported and understood, which encourages active participation in their care. Discourse analysis examines how empathetic language, e.g., "I understand this is difficult for you," impacts patient trust and willingness to engage with healthcare providers. How are patient narratives analyzed to assess engagement? Patient narratives, such as descriptions of symptoms or health experiences, reflect patients' perspectives on their conditions. Discourse analysis studies how providers respond to these narratives, whether they validate patient stories or overlook them, influencing the patient's sense of agency. What are some common power dynamics in healthcare interactions, and how do they affect engagement? Healthcare providers typically hold authority due to their expertise, which can create hierarchical dynamics. Discourse analysis investigates whether language reflects a collaborative or authoritative approach, affecting the extent to which patients feel empowered to participate in their care. How does nonverbal communication influence patient engagement? Nonverbal cues like eye contact, gestures, and posture convey attentiveness and empathy, complementing verbal language. Discourse analysis considers how these cues enhance patient engagement by reinforcing verbal messages and making patients feel valued and understood. What methods are used in discourse analysis to study patient engagement? Conversation analysis examines turn-taking and interruptions to assess engagement. Critical discourse analysis, CDA, studies power dynamics and authority in interactions. Ethnographic discourse analysis observes communication in diverse cultural contexts. Narrative analysis focuses on how patient stories are integrated into care discussions. What challenges arise in analyzing patient engagement through discourse? Challenges include the complexity of medical jargon, power imbalances that affect patient autonomy, and cultural or linguistic differences that can hinder engagement. Discourse analysts must account for these factors to accurately interpret engagement levels.